Welcome back, everyone. It's season 2 of the Sugar Queens. Thank you, all of our sweet viewers and listeners. Make sure to keep tuning in. Bookmark this on your YouTube channel. We're so glad that you're here. And guess what? Ladies, we're at the ADA. We're live at the ADA at the 85th Scientific Session here in Chicago, Illinois. As you know, I'm Dr. Eden Miller. I have been in Bend, Oregon at Diabetes Obesity Care. Rox is joining us today. I think our viewers have never met Roxy, but she's our sweet little doxy here. But I don't want to forget our other queens. Jen, introduce yourself.
Hi, I am Jennifer Goldman. I am a clinical pharmacist, a professor of pharmacy practice at Massachusetts College of Pharmacy, and clinical pharmacist at Wildlife Medical in Peabody, Massachusetts.
And I'm Davida Kruger. I'm a certified nurse practitioner. I'm at Henry Ford Health in Detroit, Michigan, in the Division of Endocrinology, Diabetes, and Low Metabolism.
Well, ladies, we have a special treat today. We have CGM and patient engagement. We actually have a real live in-person patient queen with us. And Anne-Marie, please introduce yourself.
Hi, I'm Anne-Marie Bernardino. I'm an accountant. I'm a CPA and an attorney. I'm from Marlton, New Jersey. And I was diagnosed with diabetes. I went through KDA in October. DKA.
Got it.
Diabetic ketoacidosis in October. Was hospitalized for about a week. Was misdiagnosed. Found out about 7 months after that I was misdiagnosed as type 2, but I'm actually a type 1 diabetic. And when my physician offered me the continuous glucose monitor, I just totally jumped on it because it totally helps me to monitor my blood sugars every day. And so that's where I've kind of, that's where my journey started, and it's a continuing journey, and I'm learning something new every day. Like yesterday at the conference, I learned some new things about dehydrating and hydrating and how that can get you out of DKA. And so I'm very happy to be here. I'm happy to meet everybody, and everybody's been so wonderful and great. And
so you said October,
right?
Like just a few months ago.
Yes.
Yeah. 2024. And
yes.
So you got this late in life. Tell me a little bit about that, because sometimes some of our viewers and our colleagues out there, they see people of advanced age. I hate to say it, ladies, we're getting of advanced age, right?
I'm
like
past
middle.
advanced age.
Okay. But how has that been? Because you are incorporating technology in the management of your disease.
Well, I personally love it. And I am all for it. And I want to go, even forward with more, the ketones and the insulin pumps and anything that's going to help me feel better and manage my health better. And so I don't black out like I did, because when I blacked out, when I had the DKA, I just collapsed. I don't remember anything.
Wow.
For like a couple of days. So I don't think anybody ever wants to go through that, and I certainly don't want to go through that again. So I monitor. I look at my CGM, my phone, between 60 and 90 times a day. Like, I want to know where I am, what's happening, and like there have been a few instances where, for no reason at all, like my blood sugar went down to like 45, and I was like, oh my gosh, what happened? And I always carry like shelf-stable orange juice and some other things that bring me up, and if I didn't have the monitor, I would never know until I started getting sweaty or dizzy, and I don't like that feeling at all. So I tend to like run a little bit on the higher side than the lower side.
I have a question to ask you.
Good.
You said you were misdiagnosed.
Yes.
So during that period before you were completely diagnosed, when you said CGM was wonderful, you jumped on it. Did you get CGM right from the beginning?
Right from the beginning.
Yeah.
So,
Yeah.
Yeah, right from the beginning. I was talking to my nurses and things, and like different things. And when I was in the hospital, they did all the finger sticks.
Yeah.
And I was like, I'm not doing it. I am just not doing it. They turned my fingers into like raw meat. So I was just like, they were doing it every hour on the hour. And I was like, I will never do a finger stick again. Like, you will never, ever, unless I couldn't even foresee why I would do a finger stick again.
So when you look at the data, are you looking at it? There's arrows to tell you you're on your way up, you're on your way down,
Yes.
and looking at patterns. Great. So you're really utilizing.
And then I look at it, then we can look at like 7-day windows, 14-day windows. 90-day windows. So you can see your patterns and like in waves. You can, and then you can pinpoint when your high events are, when your low events are. You can totally, like my doctor, when I went to see him, we printed out like a couple of weeks. And he's like, I see what you're doing at night. We are seeing this, we're seeing that.
Great.
So you just have to tie in, like my challenge is we have to tie in the carbs to the insulin, like how my body processes the carbs to the insulin. And I've gotten a lot better with that. But like with the heat, even today where we're in Chicago and it's unseasonably hot,
Yes.
it tanked me. And I came in here today and you noticed that you're like, listen, you look a little wonky there. But I had a couple bottles of orange juice with me, so it brought me back up. And so now I feel better.
But your sensor warned you.
Yes,
Yeah.
you were alerted.
Yes.
So she
Yes.
knew to
For
drink.
sure.
Oh yeah, I knew when I was back at the hotel to drink it.
Does the sensor, do you feel like the sensor alerts you before you actually feel the symptoms of hypoglycemia?
Yes.
Okay.
Yes.
Yeah.
Yes.
Do you have friends or family that are connected that also watch your data with you?
Well, it's funny because we can't. I don't know that we haven't been able to figure out how to connect it to my husband. My doctor has it.
We'll help you.
That's easy.
Yeah.
That's easy.
Yeah. So my
That's
doctor, I'm hooked up with my doctor's office, and he has it. And then my husband's like, well, I really should have it. And we were trying to hook the one sensor up, and I was like,
It's an invitation through the app. You'll be
Yeah,
easy.
yeah.
It's easy.
Yeah.
We'll
Yeah.
definitely get you.
So we're
hooked
doing
up
that.
for sure.
But see, so I have my one endocrinologist, but I got my better endocrinologist, and he's the one that kind of have clued me in on like getting with the nutritionist and getting this and doing a little, and he's the one that was like, these are the genetic markers. This is why we think you're not. This is why you're type 1.
And that's how they caught that. And how long
Yes.
after? So you had your presentation.
6 months,
6,
7 months, 7 months.
7 months.
What medications were you on?
So they put me on Lantus at night for long lasting, and then just the Lispro during the day.
We're really glad that you got insulin, because many times a lot of patients we see, they get misdiagnosed based on their age or maybe how they presented. And I'm so glad, because from a safety standpoint, you got CGM right out the door. I mean, that's like
Excellent.
Yes.
that's like the standards of care for sure.
And like, so he's surprised. He's like, you're really not on that much insulin. Like I would take either between 4 or 8, or even some
Yes.
days, like not anything. Be like, yesterday was a perfect day for me. Like yesterday I was like at 1:30 all day. And so that was amazing. Today, because of the heat, it kind of threw me off of the,
Yeah, but that happens.
Yeah.
So if you were doing finger sticks,
oh,
you would not, right?
No
Those
way.
where we've talked about before, that there's just those moments. in
Right?
time.
Excuse me.
excuse
let
me, what?
do
Let me
this.
write it down.
Yeah,
I'm like,
you wouldn't have seen,
no.
you wouldn't have been able to
No.
see.
you
No.
This is what happens when you're in Chicago and it's 90
Well,
degrees.
Yeah.
she would have had a low blood sugar.
Yep.
Then she would have tested to confirm it.
Yep.
She wouldn't have had any notification.
no, I mean,
Or if she would have been
Nope.
trying to run here, she probably wouldn't have stopped to do it, because it's
No,
not
right.
convenient.
right.
Yeah. Well, the other thing too that you mentioned that your one provider clued in on, is your one provider clued in on your low doses of insulin, but that you were going low with those low doses of insulin. So I know that one other provider you talked about was getting the clues from the CGM, that you were very sensitive, you would tank, so you had what we called variability. We see this. We did a prior Sugar Queens for our listeners where we looked at CGM and we were able to diagnose the type of diabetes based on the CGM profile before we did any antibodies. And so you're a astute provider looking at the data, looking at you, and your presentation went, that's not you. But you said it was 6 months later.
right.
Well, the other thing is, had she had type 2 diabetes, when they gave her insulin and broke that glucose toxicity, which again you'd also see on the CGM, she wouldn't have needed insulin. They could have thought about GLP-1, SGLT2 inhibitor, but that didn't go away.
Yeah.
So thank goodness someone did antibodies.
Yeah. Good thing.
Yeah.
Because then what they are able to do is control you according to your diagnosis and what tends to be the presenting symptoms. But I'm so glad I know that my colleagues, our hearts are to be warmed that you left the hospital with CGM. Like that was a blessing,
and-
because it doesn't happen.
And especially since they thought it was type 2. Even though she was on insulin, she left the hospital with a CGM. And we are struggling to get the community to understand that whether you have type 1 or type 2 diabetes, you should be wearing a sensor. So the 2025 standards of care say that even if you're not on insulin and you have type 2 diabetes, we should be thinking about offering a sensor. And so, we don't see the difference between type 1 and type 2. We just want everyone to have
It's diabetes. And I can't imagine like the population of like the mothers with the children, like the kids with the type 1 diabetes. I can't imagine them not jumping on this bandwagon like full force, because how are you going to monitor your kids? Like you can't, like they're going to do weird things, and you can't monitor them if they sneak in the cupboard and get some cookies, if they do this, if they do that, and that's why I was happy that I was given a tool that I can do it. Maybe some people aren't as accepting. Like I mentioned one guy I worked with, his wife has diabetes. She barely does finger sticks. And they were saying, oh, I don't know. But finally I got them to sign up. So at least she's going to try it. Yeah. And she's about 70. So
how'd you convince her?
Well, it took a couple of months, because I just kept saying to her husband, I'd be like, how come Leslie isn't going to do this? I mean, she really should do this. Like, why isn't she monitoring her sugar? You know what I mean? Like, she really should be doing this. She has diabetes. He's like, oh, this is a pain. And they were going to give her Mounjaro, but I don't know if that's going to work. And we don't know. And I just think it was maybe a little bit of the fear of the unknown, maybe a little bit of the financial. I don't know if her insurance was covering it. So, I mean, hopefully, I'm a big CGM proponent. So if anybody asks me, I'm like, listen, I love it. It was a little bit scary, like the very first time, because I saw the applicator. I'm like, oh.
Yeah, but okay, so it's
that's good. Let's talk about that.
But after you applied it,
my husband did it.
Okay,
it wasn't
you're
bad.
like nothing.
Yeah, it was not there. It was just like, oh my gosh, I didn't know if it was going to hurt or not, right? Because I was so conditioned. Oh my gosh, not at all.
Okay, so finger stick pain, CGM pain. Give me a rating.
1 to 20. Like,
yeah.
CGA was like 0.
Yeah.
It's just like a little startle. But then the finger stick is like,
Yeah.
So that's just terrible.
I wonder why the healthcare providers think they need to start someone on finger sticks.
Mm-hmm.
Just give them a CGM.
Do you think it's because it's what they've known, what they've always known?
I think there's a couple things. They've made their own decision for the patient.
Okay.
That they may or may not accept it. They may or may not use it. They may or may not get reimbursed. So I think as a healthcare provider, they're making a decision based on their feelings versus asking the patient, what do you want? How do you want it? We have plenty of people that don't get coverage, but they pay cash because they'd rather do that. They'd rather be in the know. They'd rather control their diabetes than do a finger stick.
Well, if you go through, there's a program that's the card. Mine gets covered by insurance, but it's about the same price. So if I didn't have the insurance, I could go through the card and still get my.
So the access was there.
So the access is there.
Yeah.
You just have to, I think maybe if people don't question their doctors maybe as much. They just kind of go with it. Like my first endocrinologist, it was funny because she called me after I'd seen the second endocrinologist. She's like, oh, I want you to come in for a follow-up. And I was just like, no, I'm good. Because I think she just wants to like do baseline and just like monitor it and not like be like a little bit aggressive, a little bit forward thinking. Like she didn't offer me a dietitian. She didn't, so.
Well, I think that every healthcare provider has their own style.
Right.
And then you, as a person with diabetes, gets to choose if that style meets your needs. You are paying for a service, whether you're paying out of pocket or your insurance pays for it. So if you visit a healthcare provider, I tell my patients this all the time because I refer them for eyes or cardiology or whatever. If you don't like that person or your primary care, you don't have to stay with them.
Well, I liked her. I liked her as a person, but I wanted a little bit more, right?
You wanted more engagement.
A little bit,
More data, more information.
Yeah.
So you were mentioning the hypoglycemia and the benefits you found with CGM. What about food choices and
Well, what's amazing with the food choices, like, okay, we went out to one dinner. I'll give you an example. And I said, carrot cake. My husband had it. I said, well, let me try it. Took one bite. Sugar did not spike. I was like, that's pretty interesting. Took another bite. Sugar did not spike again. So I had like probably 6 bites, maybe like half a piece of carrot cake. Sugar did not spike at all. And I was like, that's kind of interesting. So you can kind of build your own food diary of what spikes you, what doesn't spike you. You could test it. Like I know the Amish pretzels, I know their carb count It's like 36 carbs, and I know that's like a rocket ship, like glycemic. It's like, and it's like the kryptonite.
Yeah.
But once in a while, I'm like, all right, I'll take the insulin. I'll have half of a pretzel because you know you have to
You
live.
can make choices that are educated based on that.
And I know that because of what the trends that we're tracking now. If I wasn't using this, I wouldn't know
Yes.
what the pattern would be. I couldn't see the spike over the time that it spiked. And then conversely, I couldn't see like the insulin, how it went down, like how the insulin affects the sugar and it goes down.
Does your current healthcare provider download the data and go through it with you and insulin change your doses? Because you're on shots right now. You're on basal bolus, right? Do they go during the appointment and get that, what we call the ambulatory glucose profile, and walk you through it?
Well, he did it on my first meeting with him, and then I'm going to go see him. And I've only met him once so far, and then I'm supposed to go in July. Yeah, and then we put, you know, he printed it all out, and we were looking at it, and like how at night it was more stable, and you would rise during the day.
Yeah. Did you find
in the morning
that discussion was really helpful?
Oh, I loved
it. The two of you.
Yeah. No, I loved it. I loved it. Yeah, and my husband, he's also very interested in, and it's helpful because he's interested in helping me control this. He's like, listen, we have to control this. We have to do this, and he's always looking for different ways, you know, to help me monitor it, which I think is interesting. And he's the one that was like, all right, let's get the Omnipod. So we have the Omnipod.
Okay.
Oh,
so Sarah,
good.
thank you.
That's
Yeah, so we're getting that.
That's what I was going to suggest. Yes.
Yeah, so that's what, and then another thing, he's like, well, what about a pancreas transplant? And I said, well, I'm not there right now.
No.
But we're going to do,
So when are you going to start on the pump?
when I go home, probably a couple days, but we have to, someone offered at the conference to walk me through it because, you know, I just want to know how to work it.
Well, make sure there's a trainer that trains.
Yes,
Yes.
please talk to that, Davida, because when we were first talking yesterday, she doesn't have a formal training session.
Oh no, who wrote the
going.
prescription?
No. My primary care,
Okay,
but he's not my,
yeah, but that should have triggered. So when you have the box, there is a controller in the box.
Okay.
And there's a QR code. If you register the controller, it triggers Insulet to someone call you to train you.
okay, cool.
And I suggest face-to-face if possible for the first time,
Okay.
just so you absorb as much information.
We want you to start out on a very good foundation, all your questions asked, all the things. We don't want you to be the lead on that, not saying you can't do it because you're quite proactive for your own health. But we want you to have a very good, successful experience, and you deserve that kind of attention.
So it's been, like, as you said yesterday, a journey. So I started with the vials and the syringes.
Yes.
And then my provider, he's like, well, what did you do the pens? I said, okay, all right. I said, I'll do the pens. And then I was like, wow, these hurt a lot less than the syringes.
For a lot of reasons,
Yeah. So
I'm going to ask you a question about the future. So some of the things we've talked about here on the Sugar Queens is looking at what we call an integrated sensor. It's not out yet, but in the future, we're anticipating the ability to, through the same sensor, monitor your glucose and your ketones. Let's play magic for a moment, and that you would have had that ability to have that particular technology. How would that have changed your life, you think?
well, if I would have had it, I didn't know that I was going to go in DKA, right? Obviously. So I knew I was tired, and I didn't know I was just going to, you know, hit the floor one day. But if I had it and if it was offered to me, then it would give me an additional tool to know. So when I'm hitting DKA region territory, that I need to scale it back. I either have to rehydrate, I have to talk to the doctors, I have to take it, because I don't want to wind up in the hospital again. I mean, a 6-7 day stay in the hospital is hundreds of thousands of dollars. I mean, and then you have your insurance, but
And it's scary.
right.
Yeah, well, you should have DKA.
Right.
Sure.
Well, yeah, and then you think when you're in the ICU, you're hallucinating. Like I was hallucinating. I thought I was in a U-Haul truck going to Florida, and I had no idea where I was. Like one of our priests came to see us, and I was just like totally out of it. And it's not like a good feeling. I think it must feel like maybe what a dementia patient must feel like.
Oh,
Like very, like you're totally not with it. And it's not a fun thing. And having like 4 or 5 ports in one arm, it's just not something that you want to go in.
so that was at the beginning of your journey, and you didn't have the knowledge you have now.
Right.
So hopefully, you have the tools, and hopefully you have the knowledge. So hopefully that won't happen again, because if you really had a high blood sugar, you would check for ketones, whether you use what we have now or the future. And if you were positive for ketones, you'd have an opportunity.
My blood sugar was over 800.
Yeah, that's not a good number.
No.
No. So, and then, they had different heart issues and things, but
Sure.
so far we've been really good with the thing, and not too many low sugar events, not too many. So, but now I'm learning, with the heat and how that's all working now.
Well, the other thing is, when you do start the pump, it has the ability to talk directly to your sensor. And so when the sensor says, hey, this blood sugar's going up, it says, give her more insulin. When it's going down, it'll say, give her less insulin.
Which would be amazing, because it would take another, so that's, from the finger stick methodology, which was kind of like you're shooting at a dartboard and you can't connect the dots. It's really hard.
Beautiful.
Like, you cannot put the pattern together. Like, you need to organize your information, do the data analysis, put it all together, make it make sense, right? And that would even take more thinking out of it. Like, I don't have to think about, okay, let me convert these carbs to the insulin. And did I take this insulin? Did I give a shot? Wait, did I just give myself a shot? Or do I still have a shot? Or what if you overdose? What if you forgot? Like, you were doing something. Like, I'm a mom of a 12-year-old who distracts me on the phone, who tries to talk to me, interrupts me with everything. And I'm like, listen, can you step back? I'm doing my insulin, because I need to think about this.
in her head for just a minute.
Right? Right? Can I just, be in my own space for a second? So, if you do your shot and then you think, wait, did I really do my shot? And like, that would eliminate the tracking.
It really does, because you can then go back in, and if you try to do it a second time, it will tell you.
Right, because medical mistakes, what happens with medical mistakes. That's just not a good thing.
Yeah, you can speak to medical mistakes for sure.
Right?
Yeah, I've seen it happen.
Like,
somebody gave themselves 50 units of rapid acting at bedtime instead of 50 units.
No, it happens all the time.
All the time.
And then what happens? Do they go into coma?
We feed them a lot of.
Glycemia,
Yeah.
the orange juice.
If you want to have ice cream and cake, that's the night to do it.
That's the time to do it.
I didn't have an ice cream cone for about 2 years, right? Because I cut out all the white bread, white sugars, all the white processed foods. And I said to my daughter the other day, I said, I'm going to have an ice cream cone with Jimmy's.
Part of that is that's what's so imperative.
But-
There's so much forbiddens in diabetes.
The sugar went straight up.
Sure. But
But-
you're also going to learn how to incorporate it.
Right.
So on that note, I kind of want to talk a little bit as we kind of start to come to a close. Sue, you talked about how the CGM allowed you to really kind of live your life and let it do the thing. Talk to us a little bit about like alarms and things regarding that. Do you find that cumbersome? Do you find that it's actually a time saver for you? Because we get a little bit of pushback with, oh, my patient had alarms, or they have this, and it's like they're being bothered by it.
Well, I kind of do understand that being bothered by it, because if you're going low and your numbers are going low,
You want to be bothered.
right, because you're going to pass out, and then there's going to be a huge bother if they're going to
Big bother.
They're going to get a big bother by like an ambulance ride to the ER, or somebody's
Big
going to be
bother.
putting like glucose in your mouth, or it's not a good thing. And even going high, like, you want to know. I mean, because you don't want to be skyrocketing and feeling sick and wind up throwing up, and that's not a good place to be. But especially dangerous is the lows, I think. Like, the highs I can manage a little bit better. The lows I totally want to stay away from, and they kind of scare me a little bit, because I've had a couple of them, and you kind of get shaky and you get that. So I need
that heads up.
I need that heads up, and it's not annoying. I mean, it's part of life right now.
And you'll learn
It's a great
over
way to
time
look at it.
with those trends and how to make those adjustments to have less and less of that.
Right. Well, so I was telling Ian, I don't know if you remember, like in the beginning, or I don't know if I mentioned it today, I was looking at my monitor 90, 100 times a day. Now it's kind of tapered down to like 60. But I still, like, the comfort is there. It's like, where's my phone? What's my sugar? Where's my phone? What's my sugar? I want to know. Like, I want to know where I'm at. I want to know how it's being affected. I want to know how further. Like, we're going to go to Disney World in October. And now I know with the heat that I'm going to have to, right, I mean, I'm going to have to plan. And you know what? a little bit of planning, to avoid a major medical event
Sure.
is totally worth it. And I just don't understand why they wouldn't welcome the notifications.
So I want you to give us one nice kind of line for our viewers, many of those out there that are healthcare providers that are prescribing these. From the patient perspective, tell us how, by you given this opportunity, by it being mentioned by them, how it's totally changed your life.
This has totally changed my life. It's been a lifesaver. I can't stress that enough. It's been a lifesaver. It's going to help me extend my life. It's going to help me maintain my health. It's going to affect my family. My daughter's going to have a mom for longer than, if I would have been doing the finger sticks. So I can't express to you. I mean, you get a big one of those lifesavers, like either one of the candies or one of the things off the side of the boat. That's what it is. It's a lifesaver. You're throwing us a lifesaver.
I love it.
So, to extend our lives. I mean, and if they're not giving their patients this option, they're really doing them a disservice, because this is an amazing tool to carry with you to help you manage your health.
Well, ladies, I think we should make her an honorary sugar queen. What do you think?
Okay.
Yeah. And thank you so much for joining us here live.
Thank you for having me. It's been a wonderful opportunity. I love to share my viewpoints and my experiences, and I've met so many nice people, and I'm so happy that you guys are working on new things to make our lives better, and so we can manage this. And my one friend was like, I don't know how you can do this all day. And I said, I don't have a choice. Like, I have to do it. So if I didn't do it, I could potentially die. So I'm grateful for all the development that you guys are doing.
Well, it's our pleasure. Well, thank you for joining us for the Sugar Queens episode. Please stay tuned. Every month, we'll be back with some more sweet talk with the Sugar Queens.